Good evening, everyone, and welcome to the winter meeting of the Greater Boston Functional Medicine Group. This is Nina Stout coming to you from Simsbury, Connecticut. We have a great group gathered here tonight, and this is the home turf for our speaker tonight, Dr. Yuri May. So just wanted to introduce to you the format. This is a membership group, the Greater Boston Functional Medicine Group. We're a 501c6, and we have a membership drive going on right now. So if you haven't logged in to see our new website, we hope you'll do that. We hope you'll take advantage of becoming a member because we are hoping to have strength in numbers for this great community-based group for the type of medicine that we all practice. And I believe we still have a special going on where membership is typically $99 for the year, which is really very affordable, and should still be about $49 now. We will be going forward hoping to have everybody at the meetings be members. So please do check out our website. We'll send that out to you when we send out the recording for this meeting. And tonight, basically this is a group that incorporates all 6 states, and we have satellite meetings going on in each different location across the New England area. So we have a Rhode Island group at INASA, Integrative Medicine in Providence, Rhode Island, and that's Dr. Chrysanthi Kazantzis, and Tim Reardon from Metagenics is the local host and rep host. And so we also have our group in Maine, and that's Chris Alley from ITI, and he's there with Dr. Sean McCloy and his group there at Integrative Health Center of Maine. And we also have a group at Johnson Compounding with Leah Verzi from Orthomolecular. So I'm going to go ahead and just introduce Dr. Yuri May, our speaker for tonight. Dr. Yuri May was awarded the Best Biological Holistic Dentist in Connecticut in 2017 through 2020 in the US, and he's the Best Ceramic Implant Dentist globally in 2020. He has become known as USA's Best Ceramic Dental Implant Dentist. Dr. May's biological dental surgery specialization in international research in zirconia dental implants and platelet-rich fibrin, thank you. I couldn't see that. Platelet-rich fibrin, bone, and tissue graft regeneration therapy have positioned him to take on the most complex full mouth cases in the world. So as a biological dentist specialized in full mouth reconstruction and biological surgery, Dr. May is intimately familiar with treating patients with Lyme disease, autoimmune disorders, Crohn's, IBS, fibromyalgia, mold toxicity, MS, Alzheimer's disease, SIBO, and Epstein-Barr virus. So tonight, you will gain insight into the silent dangers of common dental procedures like root canals, tooth extractions, metal implants, metal fillings, and restorative dentistry. Even orthodontics can debilitate a patient's health. So we're really pleased to have Dr. May here tonight. He's a practitioner that I myself personally have chosen as a practitioner to take care of my own dental needs. And I can tell you that he's truly has a fantastic bedside manner, and he's an incredible educator. So we have a really great presentation ahead of us tonight. So thanks for welcoming Dr. May.
Thank you all. Right. This should stand. Yeah,
Get elevated if you're more comfortable.
I think I'll sit because I don't want to go back and forth. All right. So thank you all for joining. So we don't have a lot of time for a lot of the topics that I want to cover. We only have about an hour and 15 minutes. So my main focus of the topics will be covering the oral infections that are going to be affecting the rest of the body. The root canal, we're going to cover root canal treatment. We're going to cover metal titanium dental implants, and we're going to cover ischemic bone disease or cavitations, also known as focal degenerative osteonecrosis of the jaw. And I'm going to try to focus more on the medical side of things, how you as medical practitioners can relate to it and can see benefit in your patients receiving the treatment with biological dentistry. So a little bit about myself. So I would consider myself an active guy who likes to spend a lot of time outdoors, skiing, mountain biking, playing tennis, and spending time with my family, traveling with my wife and my 2 beautiful kids. So there's a lot of great books in terms of dentistry out there that anybody who's interested should definitely look into it. So Weston A. Price is one of the books that was one of the original books that I read that really opened my eyes about functional medicine and functional dentistry, how the two are related. It's something that's been around for over 100 years, and the research is still pertinent to the practice of medicine and the practice of dentistry today. Some great books that are more available that came out more recently. The Dental Diet with foreword by Dr. Hyman is a great book about dentistry and the diet and how diet is a big part of important part of our health and how dentistry fits into it. And it's all in your mouth also talks about the biological dentistry and the impact of oral health and wellness on the rest of the body. So, holistic dentistry. So what is it about? So we really view the mouth as an integral part of the body and making sure that the health of the mouth is related to the rest of the body. So in holistic dentistry, we want to utilize the latest modalities in diagnosing, latest technologies like cone beam 3D scanning, and we want to use the latest technology for treating using ozone therapy, lasers, and platelet-rich fibrins to make sure that our teeth are staying vital, that all our organs are staying vital when we're using the latest healing modalities in maximizing patients' optimal health. We want to make sure that we're using biocompatible materials like zirconia implants, ceramic restorations. Obviously, we don't want to use any BPA filling materials, no mercury, and no fluoride. So as a biological dentist, we want to make sure we educate and treat the root cause of infections like infected root canals, address metal toxicity, address focal degeneracy, osteonecrosis of the jaw, and multiple factors that may affect chronic inflammation in the body and chronic infections in the body that obviously will ill affect a person's overall health. So as a holistic dentist, the goals of the treatment is address infections, address toxic materials, and address function of the chewing system, and improve quality of life. And we want to make sure we eradicate infections, remove all toxic material, restore and improve function of the mastication, breathing, speech, and delivers a beautiful smile that somebody can be confident in. So oral health has been more in the news lately, how the bacteria in the mouth is going to be related to the rest of the body. There's been a lot of research about periodontal disease and the bacteria associated with it related to Alzheimer's disease, cardiovascular disease, diabetes, rheumatoid arthritis, and multitude of other conditions. And we'll dive into things a little bit deeper. As a holistic dentist, ozone is a big treatment modality we use for our surgeries to making sure we are achieving an environment that's sterile and we are able to kill bacteria, viruses, parasites in a way that is minimally toxic to the body. Cone beam 3D is something that allows us to see infections and diagnose in a more detailed way. It gives us a lot of information that before the 3D X-rays were available, we couldn't see. We can plan implants more precisely to make sure we don't hit any vital structures and see the infections around infected teeth or root canals that were not traditionally visible previously in the two-dimensional X-rays. So again, lecture objectives will review how the mouth relates to the body. We'll mostly focus on the root canal treatment and the toxicities associated with the root canals. We'll review the cavitation osteonecrosis and its systemic effect. And then we'll look at the metal alloys in the mouth and how they can create inflammation and toxicities in the body as well. So first of all, a tooth. By definition is an organ. It has a blood supply, it has a nerve supply, and it has a lymphatic system. And it has a function to mastication, to feel the bite, to feel how your jaws are coming together, to masticate the food, making sure we're able to break down the food to help us with the digestion, and of course, aesthetics is an important factor as well in our common day life. So the one thing, as a holistic dentist, we want to make sure that we keep teeth alive as any other organ in the body that we want to keep alive as well. So there's really no other organ in the body that you can take away a nerve supply, blood supply, and the lymphatic system and expect that organ to still be in the body. And the teeth have innervation, and the main nerve that innervates the teeth is the trigeminal nerve. It's a complex system of innervation where if we have infections or toxicities associated with teeth, they will travel through the nerve straight to the brain. And our teeth also, that nervous system is chronically, oftentimes it will be stimulated by chewing. So we chew thousands of times a day, and the teeth will send sensory input to the nerve, which is highly important to our nervous system. So this is a photo of a tooth. So the tooth is made up of multiple layers of structure. So the enamel is the outer surface of the tooth. It is the hardest structure in our body. The dentin would be in the middle part of the tooth, and then the pulp is the center of the tooth, which has the nerves and the blood flow and the lymphatic system that connects to the arteries and the nerves in the jaw. So the tooth does have, it's not a solid structure. So it does have in the dentin the dental tubules, which on the right side of the screen you can see the SEM of the dentin. So it is a very hollow structure. So the bacteria, which is in our mouth, can penetrate the dentin, and if the tooth is dead, they can basically create a habitat in those dental tubules. So we don't look at teeth as actually, little pieces of rock. That is actually a hollow structure with tubules inside. So the other thing, as a holistic dentist, we look at the tooth-organ relationship. So we believe every tooth is part of the energy meridian system. So if anybody believes in acupuncture, we know that if you place a needle in a certain part of a certain acupuncture point, you can go have effect on the different energy meridian system. So every single tooth is a part of a meridian system. And in the meridian system, we have an energy of the flow. So on the left side, electrons will flow through the meridian system up and down the meridian system. So if we have an infection in the mouth, if a tooth is infected, or we have a metal titanium implant that is infected, that will create a break in the circuit. So if the circuit is broken, then the energy flow stops. The infection will basically rob the energy meridian system of the vital energy. So any of the organs that will be located on that meridian system associated with the tooth could be affected as well, because the organ system will be robbed of vital energy and vital electron flow. So we'll look into the infected root canal. So obviously this is an example of an infected root canal where you can see bacteria, the tooth is dark. Oftentimes you can have metal associated when the tooth is restored, and looking at it is not something that you want to have inside your mouth. So what is a root canal? Root canal is a procedure where the center of the tooth is hollowed out, and the nerve and the blood flow and the lymphatic system is removed through the center of the tooth. The canals are washed and dried. Does anybody know what is the disinfectant that used to wash and dry the canals?
Laura.
What? No.
Chemotherapy?
No. Sodium hypochlorite, also known as bleach. So that is the disinfectant material that dentists will use to clean the center of the tooth. And the center of the tooth is a very complex structure. So if you can see on the bottom left, this is just an example of how the canals inside are situated, but indeed on the microscopic level, the amount of tubules and the amount of canals that we would want to disinfect the infected tooth with bleach would probably not work very ideally. And then once we clean it out, we use little paper points to dry, and then we use a rubbery material called a gutta percha to fill the middle of the tooth. And then we say, hey, it looks good on the x-ray. We filled our main canal without addressing, the whole little lateral canals and the other nerve and the nerve and the blood vessels that were inside the tooth. And then the tooth is restored back to function by putting crown in it. So from the function point of view, we keep a tooth. The tooth is functional. The reason you probably needed a root canal in the first place is to treat a tooth that is painful. The tooth that was infected, so it's addressing usually the patient's problem of pain in the tooth. However, the biological aspect of the procedure is a little bit flawed. So we leave behind often in the root canals toxins and infections, and all infections will cause tissue damage, and the teeth will have bacteria that will produce exotoxins, which can lead to oxidative stress. So if there's one book that you want to read is The Hidden Epidemic by Thomas Levy. He is a cardiologist that does a lot of research, and one of his main beliefs is a lot of the heart attacks are caused by the bacteria that is coming from the mouth. And we'll review a lot of his research. So Thomas Levy is again a cardiologist. So they did a study where they extracted over 5,000 root canal teeth. So it was dentists from all over the country would extract the teeth and send them to the laboratory for Dr. Boyd Haley to check it for pathogens. And 100% of these root canal teeth had pathogens that were highly toxic. And as a control study, they also took some teeth that were extracted for patients that were going through orthodontic treatment. Those teeth were extra teeth for those patients because the patients didn't have enough room, so the teeth didn't have any fillings or anything of that nature. So that was the control study, and none of those teeth that were kind of extracted vital had any toxins or pathogens associated with them. Dr. Mercola, we all know him in this holistic field. And so one of the studies that they looked at from Dr. Rao's clinic was the 97% of terminal cancer patients previously all had a root canal. So it doesn't necessarily mean if you have a root canal that you'll have cancer, but in that clinic, per se, everybody who was going through cancer treatment, 97% of those patients did have a root canal treated. And just because it's a common procedure that is done thousands of times every day doesn't necessarily mean it's safe. So there's more than 25 million root canals performed every year. The ADA claims the root canals have been proven safe, but there is really no published research stating the safety of the procedure. So root canals. So by definition, fatally flawed procedure. We talked about the dental tubules. There's miles and miles of dental tubules inside the tooth, which there's no way to clean those out. The fluid flow is reversed. What that addresses is naturally the flow goes from inside the tooth to outside. So we have the blood flow inside the tooth, which creates the pressure, which prevents the bacteria inside the mouth from penetrating into the tubules of the tooth. When we don't have blood flow anymore, the tooth loses its natural ability to protect itself, and then the anaerobic bacteria can go ahead and create habitat in those dental tubules. Because again, we're creating an environment that doesn't have blood flow, where once upon a time, Obviously, the tooth had blood flow, had immune system to protect itself from the bacterial invasion.
Excuse me, doctor. So, based on that, would it be in their best interest just to remove it and not even?
For a lot of the patients, that's probably the best treatment is to forego the root canal treatment and remove the tooth. So the other thing is, in the back teeth, we go ahead and do a lot of chewing every day, and that puts forces on the teeth. And as we put force on the tooth, the bacteria from inside the tooth gets pushed to the bone around it. And the bone around it obviously has blood flow and lymphatic systems. So the bacteria from inside the tooth is getting pushed out to the lymphatic system and gets transferred down the lymphatic system. So from the lymphatic, from there it drains from the jaw area to the superior vena cava, goes down the pulmonary pathway, and then the first high pressure blood flow where it comes out from the left ventricle is going to be the coronary artery. So the toxicity went down to the heart and comes out of the coronary arteries, and where often those bacteria gets deposited. So this is on the left side, the dentinal tubules of a vital tooth that doesn't have any bacteria. And then on the right side, they took a tooth that was a wisdom tooth that they knew they were going to take it out. They did a root canal on that tooth. And then the non-vital teeth, even though they didn't have an infection originally, gets colonized by the anaerobic bacteria in a matter of time. So every root canal will get colonized by bacteria. And on the right side, you can see those, miles of little microtubules will get.
How long does that take?
I don't know exactly the study, but I think within 3-6 months, every single root canal, if it wasn't a dead tooth full of bacteria to begin with, and there was, maybe somebody fractured a tooth, it's just a matter of time till the anaerobic bacteria will colonize and, create a nice habitat for themselves. Chronic periapical periodontitis is, just a big term for infection at the tip of the tooth. So not only are you going to have bacteria, but you're going to have the infection in the bone that is surrounding the tooth. And a lot of the root canal teeth will have the infection at the tip of the tooth. So with two-dimensional X-ray, it wasn't always possible to see infection at the tip of the teeth. But with 3D X-rays, that's something that we see often, that a large portion of the root canal teeth will have infection associated with it in the surrounding bone. So chronic inflammation. So the pathogens that are consisting inside the teeth will be related to the chronic inflammation and causing the atherosclerosis. So not only the periodontal disease, which has the anaerobic bacteria and the violent bacteria, but it's also the root canals and potentially the cavitations as well that can cause the chronic inflammation. So this is one of the several studies that whoever is interested can look at. The oral bacteria associated with it was found in the plaques in patients with coronary artery sclerosis, and one of the other things Dr. Levy looked at is in the patients who had heart attack. So they took the plaque associated from the heart attacks, and they looked at the pathogens that were in that plaque, and there was a great 16 times higher concentration of the bacteria that associated with the oral cavity and the root canals, and the periodontal disease that was found in the plaque of the patients who already had the heart attack. So this is just an example of what an infected root canal often looks like when you take it out. And at the tip of the tooth, you can have the infection associated with it, which is chronic periapical periodontitis. So obviously you can see on the right side also the teeth will often turn black in color. So that is bacteria creating exotoxins and discoloring the tooth. So not something that looks healthy or you want to have inside your mouth. And us as biological holistic practitioners, we obviously understand that doesn't just stay in the mouth. That will travel down and affect the rest of the body. So again, how common is the infection at the tip of the teeth? So when we had two-dimensional x-rays, about 9% of the root canals, you could see the infection at the tip of the tooth. And then with three-dimensional x-rays, you can see up to 40% of the teeth will have infection at the tip of the tooth after the root canal is completed. And that is bone loss at the tip of the tooth. That is not looking at the effect of the energy meridian system being affected. That is not looking at the healthy patients that are able to tolerate and keep the bacteria walled off inside the tooth for an extended period of time, as long as the immune system is able to tolerate the root canal.
So does that present with pain for patients?
Oftentimes, no.
Because
The nerve is dead inside the tooth, and the body is able to wall it off and keep it in place. So,
Does not present with pain.
okay.
It's like,
So another study was when dental bridges are done. A dental bridge is when you want to replace a missing tooth, and you will have to shave down the two adjacent teeth to replace a missing tooth. So it would be kind of three crowns connected together. So when you do a dental bridge, a lot of the natural tooth structure needs to be removed, and there is a result and can cause tooth death by destroying the periphery of the tooth. So when they did the study and they looked at the abutments of the teeth that are holding the bridge, so 25% of the abutment teeth were infected with chronic periodontitis. So again, if a tooth is infected and dead, you might not have pain. You can have a dead tooth that is just sitting there, that is creating inflammation, that is holding the bacteria, that is holding the viruses without pain. And unless you take a three-dimensional x-ray, or unless you have other means of checking for tooth vitality or energy meridian disruptions, there's things conventional dentistry just overlooks because the person doesn't have any pain, and oftentimes on the two-dimensional x-rays you don't see the full ramifications of the infections. So this is a study from the Journal of American Dental Associations, saying that individuals who reported having two or more root canals were statistically more likely to have coronary artery disease. So, coming from the American Dental Associations themselves. So again, the root canal treated teeth are established as a direct cause for a lot of the acute myocardial infarctions based upon the bacterial analysis done from the plaques of the heart attack patients. And again, a lot of it goes undiagnosed in terms of the infections in the mouth and having teeth that are dead that are just not causing any pain. So another study, so infected teeth lower nitric oxide levels. I think we had one of the practitioners talk about the nitric oxide and its importance. So when we have infections, they will lower the nitric oxide levels and will create more inflammatory cytokines in the body. So even the American Endodontic Association published an article stating that systemic disease is related to root canal treated teeth based upon their review of literature, and you can look into that study as well. So I don't know if anybody familiar with the documentary Root Cause. It was released in 2019. It was on Netflix for about 2 to 3 weeks. It was a documentary that addressed root canals as the main topic and cavitations. So it followed through a story of a patient going through dental treatment and health improvement. And within 2 weeks, it was actually like one of the top on the charts on Netflix until it was removed and censored from Netflix within several weeks. So the American Dental Associations and the Endodontic Association kindly asked Netflix to stop hosting and displaying the documentary. So that's something that is against the
Community
church,
standards.
against the community standards. So just a quick case review of somebody, if they come in with an infected root canal and we want to replace it with the metal-free ceramic implants. What is a typical journey for an implant for a patient that goes through it? So this is an example of a tooth that's infected with the infection at the tip of the tooth. When you look inside the mouth, looks pretty benign. The tooth looks pretty normal, but on the X-ray you can see pretty large infection at the tip of the tooth. We'll go ahead and remove the tooth atraumatically, clean out the infection, and place the ceramic implant at the same time. The goal of the treatment always is try to maintain the bone and place ceramic implant in combination with PRF grafting after disinfecting with ozone and lasers. So you can see this is right after, right mid-surgery, that's things done atraumatically. We modified the ceramic implant to the ideal shape of the front tooth, and then we will go ahead and give patient a temporary restoration. During the healing phase, when the implant is placed, we don't want to put any forces on the implant while things are healing. So the tooth is attached. The front tooth will be attached to the adjacent teeth to minimize the force that will go on the front tooth. That's how the X-ray will look like with the implant going a little bit to the inside of where the tooth was after the infection is cleaned out. And 4 months later, on the left side, we see how the tissue heals nicely around the ceramic implant. The patient will come back. We will remove the temporary restoration. So you can see beautiful ceramic implant with nice, healthy gums around ceramic implants, which is one of the big differences we see compared to metal implants is healthy, non-inflamed gum tissue around the ceramics. And then in our office, we'll often be able to make the crown for the patient in the same day. And that's how the patient will leave, right afterwards with the front tooth replaced with the ceramic implant and the crown on the left side, mimicking the natural appearance and natural gum structure similar to what they started with. So this would be a typical process for somebody who comes in with an infected root canal or failing tooth, and the best way to replace that would be remove the tooth, and if need be replaced, as example for this patient, if it's a front tooth, that was the most people will get replaced, to replace it with a metal-free ceramic implant. A couple more studies in terms of the root canals and the pathogens associated with root canal treated teeth contribute to degradation of mitochondrial function. So again, when we create oxidative stress from infected teeth and bacteria from the infected teeth, it will reduce mitochondrial function, and when we reduce mitochondrial function, it's obviously cellular function. Every cell of the body will be affected. And there's studies showing that endodontically treated teeth will have a negative effect on systemic disease. So that's something that's not commonly discussed. Obviously, that's not an informed consent. When that goes to the patient, that's not something that states to the patient that there's possibility of endotoxins associated with root canals that will decrease the quality of life and increase oxidative stress. So that's in the literature, we have it out there. If we read between the lines, if we look at both sides of the story, it's published information that infections from root canals will affect the rest of the body in a negative way. So that covers a lot of the information for the root canals. So the second big topic I want to review is cavitations, also known as osteonecrosis of the jaw. So it's a area of the bone that is unhealed, typically going to be after extraction. We'll often find in the bone and oily cysts and focal infection in the jawbone. So it's going to be usually a local reaction in the jawbone, and the cause either going to be local from a past extraction, or it could be a systemic issue associated with poor nutrition after surgery or use of medication that will affect bone healing. Osteoporosis medications is a great example of it. So the potential causes for formation of cavitations, which is unhealed bone sites, is after the removal of infected teeth. If all of the infection is now removed and there's remaining infection in the bone that was left behind, infected periodontal ligament, which is the structure that holds the tooth, if that's not removed during the extraction. Oftentimes we find the cavitations in the wisdom teeth sites. Again, a lot of people go through removal of wisdom tooth extractions and surgical trauma, overheating of the bone, or use of epinephrine, which is a vasoconstrictor in the area. Again, decreasing blood flow to the area will cause abnormal healing. Or it could be something like bisphosphonate therapy, radiation therapy, or chemotherapy that the patient is taking, corticosteroids. Again, those are all things will ill affect bone healing after surgery that can lead to the formation of cavitation. So how do we diagnose a cavitation? So cavitation is an area when we look on the 3D scan, is going to be an area of low density of bone. So it's actually, because it's going to be a hollow space within the jaw. So you might have the outer aspect of the bone, the cortical bone might be in place, but in the cavitation is going to be a hollow space. So cone beams show the density of the bone. So again, when we kind of look at the patient, we'll take a 3D scan and we'll look for abnormal healing in the wisdom teeth sites. We'll look at the root canals and potential periodontal infections associated with them. We'll look at the titanium dental implants. Do they have bone loss around them? Do they have inflammation around them? Those are all the things that we will review during initial visits. So to diagnose, obviously cone beam is one of the main ways to do it. People that do energy meridian testing, and they can test if certain teeth are affecting the meridian, the energy flow, they can suspect it. There's certain medical practitioners that even have an x-ray in their office. I don't know if anyone's familiar with Dr. Simon Yu. He is in St. Louis. He's a medical practitioner that has a panoramic x-ray that does energy meridian testing that will check for root canals and check if patient's energy meridian is associated with it. If somebody does applied kinesiology, again, it's another way to go ahead and check for potential infections, cavitations in the mouth, and detailed medical health history not to be underlooked. So all of you as functional medicine practitioners take detailed medical histories. So somebody who did IFM, they review it, making sure that you do the dental history along as well with the medical history. So you create the timeline of events. You ask about the cavitation. You ask about if you had wisdom teeth extracted. You ask about root canals. You ask about titanium, if you had titanium implants. So those are all the things that you want to ask in your medical history when you're creating the timeline. You're creating a timeline of symptoms when they occurred. Having dental treatment and timelines of those dental treatment is an important piece of the puzzle. And as a functional medicine practitioners, that's what you guys do. You try to solve the puzzles, and oftentimes those puzzles are very complicated, very detailed, and have many layers. And this is another layer to look into and have in your arsenal when you're trying to get to the bottom of it. So this is what the cavitation could look like. It's an area of dead bone, and a bone that doesn't have blood flow, and will have potentially viruses, bacteria, parasites associated with it. So in a 3D scan on the left side, you can see the area that's circled red behind the root canal. It's an area of low bone density, which when you take a 3D scan, you can actually check digitally what it looks like. And then when we do the extraction of the root canal tooth, behind it is going to be a hollow tunnel inside the jawbone. Underneath the cortical bone, which might be a little hard, is just a hollow space filled with fatty cysts, bacteria, viruses, parasites, and this, gnarly tissue, infected tissue that will be within the jawbone. So this example of what cone beam, what you can see on the cone beam relative to the surgical site. Quick video of what the cavitations could look like inside. So this is upper jaw surgery. So somebody who had wisdom teeth extracted a long time ago. So we just reflected.
Yeah, you should just disclaim that anyone who doesn't
Yeah,
look away.
look away. So you can see just pus coming from inside the bone. So that's pretty common. Just hollow bone. So you just poke a little bit of the bone, and underneath it, it's a cyst-filled area full of fatty tissue, bone that is broken down. So now the name is degenerative osteonecrosis of the jaw. And again, you're just gonna use a little instrument and you poke at it, and you
And
can
these people
see
have pain, right?
no pain,
No pain?
no pain.
So why are they there?
What?
Why did they go to you?
Why did they go to me? Because
They
most
don't
of
feel
them,
well.
they don't feel well. Most of them have been through, 5, 10 medical practitioners, and they've checked off a lot of check marks, and they treated a lot of things. And they're like, this is the one thing I haven't looked at. So again, the lower jaw, similar situation. You remove kind of the upper cortical bone, and the side of it is going to be a fatty cyst.
So in case like her, she must have had a wisdom teeth so long ago. Does it just, the bone just never heals?
The bone never heals. So you have the outer shell of the bone that's there, but the inside of the bone is hollow, which, crazy. And the bone should have blood flow. Bone is alive. So you shouldn't have an empty hole within the bone. So once
So
you
what's
extract
the-
it,
What's the percentage of root canals that turn out, wisdom teeth extractions that result in this?
I need to.
I don't have the number, but my practice is going to be skewed. The people that come see me will, they suspect it. They do the research, they read about it, but I don't have the number, but I would say maybe 30, 40, 50%.
Of people who have wisdom teeth
Yes.
teeth extractions have
Yeah, it depends when they have it extracted and what age, what was their state of health when they had it extracted. So this multifactorial, whether the teeth were fully impacted, whether the teeth were wrapped in, but, multifactorial, but
And Dr. May, you should mention there can be NICO, IBD, FDOJ, synonyms, but not.
synonyms for cavitation is a layman term. FDOJ is focal degenerative osteonecrosis of the jaw. NICO is neuralgia inducing, so some people can have pain associated with it, because if you have the bacteria associated with it, it's going to be next to the in the lower jaw, next to the inferior alveolar nerve, can create the inflammation of the nerve. So some people can have facial pain associated with it. Some people will have no pain.
And so people are coming in with these diagnoses, or this is just something that you're finding?
Some people coming in, they were diagnosed by somebody else. Some people, coming in because they were diagnosed by a medical practitioner who does energy meridian testing and do it. Some people saying I think I have it because I've done my research, and when I had my wisdom teeth extracted, I had dry sockets, and this is likely. Some people coming in, unanswered questions, and they want to check, see if it's there. See if it's, a potential. So what's inside the cavitation? Often we'll find bacteria, viruses, fungi, parasites, and a lot of inflammatory cells. Obviously, if you have pus in there, you're going to have inflammation and inflammatory cells associated with it. And for some people, it's going to be, pain associated with it, but not necessarily. So on the left side, we see the histology of normal bone. Again, bone is alive, two structures within the bone. You should not have hollow spaces. And as you saw, an example of fatty cyst is a common thing, inflammatory cells, ischemic bone, meaning the bone that doesn't have blood flow. So again, these are the areas that don't have blood flow to the inside the bone. Again, our immune system is based upon the lymphatic system and being able to get your natural immune system, you need blood flow. So if you don't have blood flow, that's a perfect area for the bacteria, viruses, parasites to make a home. So this is one of our patients that we did that, she was a Lyme patient. She's been, through multiple levels of Lyme treatment. So on the left side, she did a urine test and we sent it to DNA connection with a PCR test. So with the COVID, we're all familiar with PCR test, we amplified and to check for the pathogens. So she only had, 3 bugs associated on the left side. Then we took some of the blood/tissue from the cavitation site and we sent it out to the same laboratory to test for the bugs. And then you can see on the right side, the number of bacteria that was in that cavitation sample associated with Lyme was a lot, greater compared to the patient's urine sample. So again, Lyme likes to hide in areas where the immune system cannot get to them well. So an area inside the jawbone where you don't have blood flow in the lymphatic system, it's a perfect hiding spot for them. So when somebody goes on IV antibiotics, right, you need blood flow for the antibiotics to deliver it to the area. So if you have bacteria inside the tooth or inside the bone that don't have blood flow, that's a perfect hiding spot for them. So you can have anaerobic bacteria, those viruses, those parasites, find the hiding spots in the place that is, void of an immune system.
So what you do is this, you use an ozone therapy for healing those.
So for the cavitation surgery, it's a whole protocol. Ozone is part of it, laser is part of it, PRF is part of it, removing all infected tissue. So, it's a detailed protocol to make sure that we remove the infected tissue and we create the environment for the body to make bone. So we want to regenerate blood flow to the area. We want to create an environment for your body to heal. Our bodies have innate ability to heal. And if we change the environment by removing the pathogens, we stimulate the blood flow to the area, the bone will heal if we create that environment. So I don't know if anybody's familiar with Rontis CCL5. Anybody heard of the inflammatory cytokine associated? Show of hands. No? Okay, so that's one of the inflammatory cytokines that is found in the jawbone. And in PubMed, there's a multitude of conditions that are associated with that inflammatory cytokines. So cancers, cardiovascular disease, colon cancer, so multiple sclerosis. So more and more studies are coming out about the effects of Rontis or CCL5, which is a chemokine associated with chronic inflammation. So that is the so the cavitations will have higher elevated levels of these inflammatory cytokine Rontis, which will affect the fibroblasts that are associated in the area, but also will create inflammation through the rest of the body. So this is just one of the study relating the cytokines that are found in the cavitations with the rest of the body. We'll also look at the chronic fatigue syndrome associated with the the bone marrow, the infection within the jawbone. So we have elevated levels of the Rantis, which is that inflammatory cytokine within the FDOJ, which is again the infection of the jawbone. That inflammatory cytokine can create inflammation in the brain, which again contributes to chronic fatigue syndrome. Also in this study, they found within the cavitation the Aspergillia, which is a mold. And again, that's going to affect the mitochondrial function. So when you affect the mitochondrial function, that can contribute to chronic fatigue syndrome. So again, this is one of the studies that they can look at associated with these, chronic infection of the jawbone and chronic fatigue. And that is the pathway that we'll look at. So again, Rontis associated with chronic fatigue. I'm gonna go a little quick because we only got 25 minutes and got a lot to cover. So again, they took normal bone on the red. They took the NICO, which is the cavitation site. So they took some samples from it and they tested for inflammatory cytokines associated with it. So we could see a 30-fold increase in the Rontis and then increase in the interleukin-1 as well. And then again, when we look at the macroscopic slide on the left side, that is, the fatty degeneration of the marrow within the bone instead of having the cancellous bone that's kind of degenerated. And on the histology slide, we see all the chronic inflammatory cells associated with it. So, chronic inflammation in the jawbone. So again, another study looking at the site of inflammation. And then there's an overexpression of the chemokines associated with the chronic inflammation in the rest of the body. So the runs at CCL5. So for anybody who's not familiar, look into that as well. So American Heart Association looked at the Rontis as well in literature, and we can see chronic inflammation leading, associated with obesity and metabolic syndrome. So when we have these unresolved infections in the jawbone, that will create inflammation throughout the body, and it will affect the rest of the systems. So again, the American Heart Association looks at the Rontis as in different metabolic pathways associated with obesity. How is it going to affect the pancreas, the potential atherosclerosis, and the effect on the liver? Again, so inflammatory cytokine, that's something we want to look at when we're looking at the root cause and the overall health of the patient. So another study looking at the kind of targeting this inflammatory cytokines at the treatment of the chronic inflammatory disease. So a lot of the conditions that you and naturopath will treat as chronic inflammatory diseases. So we want to make sure we don't overlook one of the sources of the Rontis, which is again inflammatory molecules. So another study looking at that molecule and contributing to pathogenesis of Hashimoto's study. Again, autoimmune disease associated with thyroid, very common, something you probably see in a great deal of patients. So patients who had coronary vascular disease had associated levels of this inflammatory cytokine. And then we want to look at all of the sources and reduce the inflammation that can lead to coronary vascular disease. So the patients that will have, the patients that have infection and dry sockets after the extractions are at a higher risk of developing the NICO, which is neuralgia, pain, and cavitation on those sites. So, you don't have to use the teeth sites. You can have a dry socket after the extraction that got bad because somebody had an infected tooth that wasn't cleaned out properly. Maybe there was too much epinephrine used, not enough blood flow, and PRF is not something that's commonly used, or ozone. That's not something commonly used by traditional dentists after the extractions. So, after there's a high likelihood of developing poorly healed extraction site when biological surgical protocols are not used during surgery. So now ultrasound is coming out as a potential option of looking for those low density options in the jawbone as well. Another way to check for potential cavitations. So that is something that is available in Europe, but unfortunately not in the United States yet. So that's going through the FDA approval. So that's going to give us another tool to correlate what we're seeing on the 3D scan on the cone beam, the density with that, and then using the ultrasound as an additional tool to diagnose this low density areas within the jawbone. So this is an example of the study where they kind of took the 3D scan and took the ultrasound, and then they did the surgery of the poorly healed extraction site. In the histology, you can see the fatty cysts associated with the tissue that was removed, and then again the high inflammatory cytokines in those poorly healed surgical sites. So on the left side, you see kind of the cone beam with the low density, so the hollow bone within the jaw. And on the right side, again, you kind of saw it in the video, but there's multiple presentations of how that infected tissue in the jawbone could look like. And again, high inflammatory cytokines that will be found in the area. So the last area we want to look at is metals and titanium alloys in the mouth and systemic effects associated with metals implanted in the mouth. So negative ways that the metal alloys could affect the body would be allergy-mediated response. Again, there's going to be multiple metals within a titanium alloy placed in the mouth, multiple metal crowns that are placed in the mouth. So you can have allergies. It's not only titanium, it's a multitude of metals. We'll look at that. Again, inflammatory cytokines. So when you have inflammations around metal implants, that inflammation we know creates inflammatory cytokines, and that doesn't stay just in the mouth. That will affect the rest of the system. Energy meridian disruptions. We talked about the teeth being part of the meridian system, and when you have an infection, that robs the energy of the meridians from the energy meridian flow. So again, when you have metal titanium implants placed in the energy meridian, it will rob other systems in the body from it. Galvanic effects, which is different metals within the mouth, will create various action potentials on the neural system, and an EMF disruption. So metals in the mouth work as antenna. They will absorb higher level of the EMF. There's studies showing higher bone temperature around titanium implants when we use electromagnetic, like a cell phone, when we're using a cell phone next to our head, the metal implants will absorb it. So again, to understand the common titanium alloy that is used in the in dentistry is titanium, aluminum, vanadium. Say 95% of the titanium implants, that is the alloy that is used. So 6% aluminum. We have some vanadium, but when we look at the impurity, there's no way to create absolutely pure metal. We'll always have some nickel associated in those metal implants, addition iron, copper, and other metals. So these are going to be the metals that will be in small amount of percentage in a titanium dental implant. So again, aluminum, beryllium, chromium, copper. Nickel is a big one, obviously. We all know nickel is an issue, palladium. And again, it doesn't take much of those ions to create an allergic reaction. It doesn't take much of those ions to create an inflammatory reaction. Our immune system's very sensitive to it. And that's the truth that is not told is, what is the true composition of the metal implants. So one of the pathways of inflammation is the metal implants. They will go through corrosion process, and little pieces of the metal will come off in the surrounding tissue. The macrophages are going to be the main immune cell that will locally try to clean up the metal ions associated with the metal implant, or the abutment, which is the extension that goes through the implant, which is a different metal, or the metal crown associated with the dental implant. And again, we're creating all of those inflammatory cytokines, TNF-alpha, interleukin-1, interleukin-6. Those are kind of the common ones that will locally create the destruction of the bone around the metal implants, which is periimplantitis, or will affect, things systemically. And, the TNF-alpha and TNF-beta will cause the localized tissue disruption, but the question is what also could be the systemic effect of these inflammatory cytokines that are constantly there and constantly every day. You're getting more and more additional exposure because, right, those metals that are implanted in your mouth, there's really no way to get rid of them unless you see the dentist to have it explanted. So the chronic inflammation persists with the person. Again, TNF-alpha interleukin-1, right? It's not only locally that we're concerned about around the tooth, which is periodontitis or inflammation, which a lot of dentists consider normal. If there's some redness or bleeding around the metal implants, that's considered the norm. But the question is, what is happening to the rest of the body? So these are just some of the kind of pathways we want to look at. Titanium allergy can be, again, titanium implant can cause allergy. Hypersensitivity reaction should be not underestimated. So again, removal would be the choice. Example of a couple titanium implants placed with inflammation around them, and then we take the tissue from the inflamed tissue around these implants, and we run the analysis again. These are all the inflammatory cytokines that are commonly found in that tissue. FDA, we all know how much we can trust them, but nevertheless, they reviewed the use of metal implants and being implanted. And, it's not only the dental implants in the mouth, they looked also at implants associated with orthopedic surgery. And, these are some of the things that are concerned. Again, bacteria going ahead and colonizing it, periodontal disease around the oxidation and in an acid environment. So again, the mouth, unlike orthopedic surgery, is an environment which has a lot of changes in pH, a lot of bacteria in the oral cavity. So the metals in the oral cavity will go through more corrosion process compared to a closed system like an orthopedic surgery and somebody, a head going to be replaced. So the mouth is definitely full of bacteria and full of corrosion processes. And then when you have inflammation, they can lead to expression of inflammatory cytokine and bone loss associated with that. So again, aluminum, vanadium are the other particles that are associated, that are part of the titanium dental implants that are overlooked. A lot of practitioners because we call it titanium. But again, those are the particles that are going to be released through the corrosion process in the mouth. So again, FDA looking at the holistic view indicate that inflammatory process can be elicited by implants in the presence of, debris coming off of it. So again, dysregulation and inflammatory imbalances associated with metals that are embedded in the mouth. So titanium ions are deposited systemically and can lead to toxic reactions. So the metal ions will come off from the implants, will be absorbed by immune cells and go down the lymphatic systems because that's in the bone and the gum tissue around the teeth. And once they go down the lymphatic system, that's down to the rest of the body. We don't know the full implication of the health effects associated with them. Again, we talked about titanium implants acting like an EMF antenna, collecting harmful radio waves. So, cell phone use, Wi-Fi, that's just going to be amplified if you have a metal implant, and that's something could be potentially very close to your brain. So again, EMF being affecting the rest of the body. So incidence of periimplantitis. What is periimplantitis? This is a local inflammation around dental implants, which will contribute with bleeding or the gums around it, red gums around it, and potential bone loss. So, typical dental study showing 34% of dental implants at 2 years will have some inflammation around them, and that's considered normal. Another study showing, between 1% and 85, by 5 years, by 5 years you get about 40% of the implants will have some inflammation around them. So again, if we consider any other part of the body, bleeding gums is normal, but if you have inflammation of the mucosa in other parts of the body, eyes, nose, would it be okay? In dentistry, it's okay. Again, chronic inflammation around dental implants, metal dental implants is considered okay. Why? Because again, it's common, 40%. Right? Is common considered normal? That's kind of the question. So again, titanium implants will have, again, higher, 30% higher of the inflammatory cytokines, the RANTES associated with them. So this is an example of somebody who on the X-ray on the left side looks somewhat normal, but the bone around the metal implants is going through chronic inflammation. So by definition, you have a tooth, you have a dental implant, it's functioning, you have a tooth replaced, so that's considered normal. But when we look at the inflammation in the bone is present around it, you have the fatty degeneration of the fatty breakdown of the bone. You have increase of all the inflammatory cytokines around the dental implants. And then this is an example of what when the titanium dental implant is removed from the bone. You can see that the metal implants are not staying together. You can see parts of those metal ions being released in the bone around it. And right, if they're released in the bone, that's they will travel through the immune system, through the lymphatic system to the rest of the body. So titanium, aluminum, vanadium, and you saw all the other different metals associated with it. Histologically, if we look at it, again, these are titanium implants with chronic inflammation around it. You can have this, the yellow fatty degenerative bone around the titanium dental implants. So, again, this is the pathway associated with the inflammatory cytokines. The metal implants will release different ions, and then you get breakdown in the bone locally. And then the question is, what are those inflammatory cytokines causing from systemic inflammation? Another study with, again, I'm going to go through this pretty quick because we get to the couple of cases. So again, allergic reaction, another common thing that is kind of overlooked at associated with metal implants. So this patient has several dental implants placed. They had symptomatic, had eczema throughout his torso. They did a patch testing. The patient came out allergic to titanium oxide. The implants were removed, and this is the resolution of the eczema without no other treatment, but the removal of the metal implants. So again, as all practitioners, detailed medical history is important when you're trying to kind of piece those little pieces of the puzzle together. So again, titanium leads to inflammation throughout the body. You can have allergic reaction, or you can have, humoral immunity associated with inflammatory cytokine. Again, just another view of, how metal implants can be affecting the rest of the body. Local inflammation could be via the trigeminal nerve, affecting that, and then the meridian system. Just a quick view of Dr. Schroeder. He's an orthopedic surgeon. He specializes in removing a lot of implants associated, and he's a podiatrist, so like in the foot. So these are, some of the symptoms that he found in his patients: fibromyalgia, joint pain, severe fatigue, difficulty sleeping, migraines, skin issues, emotional issues, osteoarthritis. So for him, he will remove a lot of the metal implants in the he's a foot surgeon, so in the feet. And then the bottom right is you can measure the action potentials of the metal associated with it. So when you have the action potential that is a lot of electrical flow, that will affect cellular function as well, and nerve function, because our nerves conduct electricity. So the different metals in the body will create a galvanic effect and affect the resting potential of the cells, and if our cells cannot function properly due to poor resting potential, it's going to affect their cellular function. So oral galvanism can lead to a source of discomfort in the mouth. So oral galvanism is just multitude of different metals associated, multiple different metals that will create galvanic effect, which is differences in electrical flow. Look at that. All right. So oral dysbiosis associated with, systemic disease as well. So a couple of cases, because we're running out of time. So these are just a couple of patients. So this is an example of a patient that came in with pressure upper part of the face, pressure behind the eye, chronic pain in the jaw, headaches, dizziness, acidic taste in the mouth, metal taste in the mouth, and some of the things she had, poor breathing, poor sleep. So she had, root canals. She had 8 metal dental implants, and then she had some cavitations in the jawbone. So we removed her root canals. We removed titanium dental implants and replaced with ceramic dental implants and addressed the cavitations. So, this is just an example of the things that kind of the symptoms that patients come in with. And then we'll look at them and say, there is a possibility that what we're seeing in the mouth, like the root canals, the metal implants, and the cavitations could be contributory to all of these symptoms. There's no 100% way to correlate it. There's no way to say, these are the symptoms, they're going to be improved. But, this is pretty common for us after, seeing hundreds and hundreds of these patients that, we do see the resolutions for some of these symptoms. So this is just an example of one of our patients, and these are all the different metals that were removed from her mouth. This is just one side of the mouth. So you have titanium dental implant, which is one implant. You have the extension, which is the post called the abutment. That's the second metal. You have the screw that holds the abutment. That is the third metal. You have a metal dental crown, which is a fourth metal, and then those dental crowns could be made out of different alloys. So 5, 6 different metals. So no wonder she was feeling having the taste of acidity in the mouth, the taste of metal in the mouth. So it's a chronic battery that was in her mouth, with a chronic corrosion, and neurologically it's going to affect the local nerves, and systemically, I don't know how. These are just the symptoms. You just notice yourself that we're improving. So again, another patient that came in recently from Vermont. So she had 8 titanium dental implants placed in the upper jaw. She did not have them removed yet because after placing those implants, she developed a perfectly healthy lady. All of a sudden, chronic fatigue, joint pain, joint swelling, fibromyalgia, general weakness. She's got some skin rash. On the blood levels, she got decreased lymphocyte counts, and she never went through actually restoring those dental implants because she's just like so terrified. So this is kind of how she looked at how she presented, and then if you just kind of press, you can see pus coming out from one of those areas that are kind of right over the implant. So you can obviously see not a healthy situation of pus coming out. That's again something that she's constantly swallowing. It's constantly something her immune system's got to fight every day. And from right, got 5 more minutes. So this is just kind of one of our patient testimonials. So just an example of somebody that kind of comes into us, and how they go through the treatment, and what experience a patient could have. Do you have sound? Sound?
Susan, from Connecticut. I've had pain in my lower teeth. I went to the dentist, and he did a second root canal in the back 2 teeth. And after 4 weeks of pain, ice packs, and 2 hours of sleep at night, I could go on back and just right.
Hi, I'm Rebecca Tibble. I'm Dr. May's patient. I've been suffering with late stage neurological Lyme for a little over 5 years. So I was having a lot of pain in my jaw, an area where I had 2 root canals done. My regular dentist said that there was no possible way of infection due to the fact that the nerves were dead. So he just said, you know, it could just be pain in your mouth. Looking into research that I've done, I did find that when you have root canals, your teeth are dead. They are considered organs. And if you have Lyme disease and other co-infections, they could be hiding within that dead organ or in the area of the mouth where a tooth is no longer living. I did see that Dr. May does ozone. So I made an appointment. He came and looked at my mouth, looked at x-rays, saw that there was huge infection in both root canal teeth and my jaw. They took a sample of plaque, put it under the microscope, and saw actual live spirochetes, which we connect back to the Lyme disease. So it was the first time that I actually saw the spirochete alive, and it verified that Lyme or the infections were still current in my mouth. I was at the point, I had just gone back to my teaching career after having to resign after 15 years. I was bedridden, lost 50 pounds, constant visual issues, constant dizziness, sound sensitivity. Everything always stemmed within the mouth, the ears, the eyes. Dr. May believed that a huge piece of my neurological issues were connected to the infection in my mouth. My life was non-existent, couldn't work, couldn't exercise, trouble sleeping, even though the exhaustion was unbearable. I have a 10-year-old son, missed his sports, couldn't play. So when Dr. May said the surgery was recommended and that it was something that I should do, I didn't even hesitate. We booked the appointment that day. Before the surgery, I came to see him for some ozone treatments, which immediately you could feel it because I had so much infection. The pain radiated. But after the ozone initially, I could feel the reduction of that constant throb where the root canals were. So when he performed the surgery, he did remove both dead teeth. He took PRF and regenerated some bone for my lower jaw. I did have some decay in my jaw and infection, which he did show me after the surgery. Took my 2 teeth out and stitched me back up, gave me more ozone, and good to go. I definitely, when he saw me after the first couple months, he saw a spike in my energy. He did the muscle testing, which showed a lot of the infection gone. He would put the ozone in, there would be 0 pain. The throbbing went away, my energy went up, back working full time. There was huge change in my health. Dr. May and his staff, see, I could get emotional, they're like family. I literally left this office after probably my 2nd visit, hugging the girls. They are truly a family. You never feel uncomfortable. You actually look forward to coming into your appointments. When I made my appointment with Dr. May's office, I was told of a consultation fee, and it was more than I had expected. For a lot of people, they're used to insurance covering dental procedures or dental examinations. The examination was extensive. It was thorough. He spent time with me. I never felt rushed. He answered every question I had. Everything was explained to me explicitly down to the next appointment that I would have or the appointments leading months down the road. Everything was laid out for me, but there was never pressure to do the treatments that I needed to do. He left it in my hands, but he allowed me to know if I did those treatments, what my life would be like and why it was important to have it done. But there was never pressure. It was worth every cent. If your health is that important to you, if you are suffering, if you have ailments, even if you don't have ailments, but your mouth is important to you, there is no amount of money that should stop you from getting your health back. Without Dr. May, I would not be sitting here right now. I would not probably be working to the extent that I could work. I could not be a parent the way I want to be a parent, a wife. I couldn't be the wife I am. So he gave me a huge chunk of my health back. I lost 2 years of my life with my son, literally. So for me, I am a researcher. I researched him as a dentist. I research, or as a biological dentist, I researched Dr. May's background. I researched all of his reviews from current patients. I needed my health back, and he gave me a huge piece of that back.
One more video? One more? Yeah. Right. Go back.
Susan, and I'm from Clinton, Connecticut. I had pain in my lower teeth, and I went to the dentist, and he did a second root canal in the back two teeth. And after 4 weeks of pain and, ice packs and 2 hours of sleep at night, I kept going back. He kept readjusting the bite. So finally, we went to the endodontist who did a third root canal in the back tooth. And in the meantime, from all the antibiotics, I ended up with C. diff for 4 months and had to see a specialist for that. So needless to say, I had to switch dentists. And then I started getting, more tooth pain. And I went to this other dentist who sent me to an endodontist. And they ended up doing 3 more root canals. And then the endodontist, after the pain still didn't go away, told me that he couldn't help me. So then I was having visual problems where I couldn't even walk into a grocery store because the optic nerve was being affected. And when I started having the optical problems, then my life was just horrible. I couldn't, I had people go with me to the grocery store, because I was so disoriented that basically I didn't have a life. That went on. I went to specialists on MRIs and everything because they couldn't figure out what was wrong. And then they ended up, I was seeing a chiropractic neurologist, and that was helping for a little bit. And then he did an adjustment, and I ended up in Yale, New Haven for vertigo after 4 years of being sick and, multiple doctors and expenses and stuff. I finally ran into a friend who said that her daughter had similar symptoms. So she told me about Dr. May. The first visit with all the testing and everything was very thorough. So, and I felt like I was finally, in a place where I could get help. The initial shock of how many teeth I would need removed, plus the expense, was, I had to go home and think about it. And then I'm like, well, could we do 1 tooth at a time? But really, having the 10 teeth out and then the other, 4, I don't even remember any of it. It was just so, easy. So yeah, I understand why you get it all done at once. And even when we did the 3 or 3.5 hour appointments, when we used the movie glasses, I started laughing during the movie because I forgot that I was in the chair, that he was actually working on me. I was like, oh God. A lot of dentists just do what they've been doing. They don't do the ozone shots. And if I'd known the dangers of root canal, which I did research on after, I never would have had a root canal done in my mouth ever. So just finding out that doctors aren't always up to date with the best techniques. And some of them were just misdiagnosed. You know, I had many doctors misdiagnose what I had. If I hadn't met or talked to my friend and she hadn't told me about her daughter having the similar symptoms and directing me to Dr. May, who had helped her daughter who had the Lyme disease, I probably would still be, you know, at home sick and basically having no life because nobody could figure out what was wrong. So if it wasn't for Dr. May, you know, I wouldn't be where I am today. I don't think there are too many other dentists like Dr. May that have his range of knowledge and qualifications for treating dental issues, which lead to all sorts of health issues. I live along the shoreline, so I walk along the beach at Hammonasset a lot. And right after I got the teeth in, I was walking past this guy and I smiled and he said, "Wow, you got a great smile." And that was like the first time somebody had complimented me on my teeth. I'm able to at least, you know, like travel and do hiking and things that I was doing, well, I couldn't do for years. After all the treatments and stuff, I've gotten 3/4 of my life back.
Yeah.
I'll have to repeat the question.
So the question is, if we're removing a failing metal implant and we want to replace it with a ceramic implant,
Yes.
most of the time it's going to be same day procedure. Most of the time we're able to remove the failing implant. Yeah, remove the infected tissues, remove the infected bone, and as long as there is enough bone remaining to place a ceramic implant and do some grafting around it, we will always try to do it in one surgery.
But it's just that if there is a bone damage, there is
Depends how much bone is.
you need to regrow or do bone grafting.
If you need,
If the bone is
Right.
healthy enough to support it.
Right, then-
You're gonna go ahead and grow the bone. first.
right, you're gonna grow the bone first, you're gonna wait for the bone to heal, you're gonna, and then you, and then you're gonna graft. So the question is, what do you recommend if you need to have your wisdom teeth out? See a biological dentist and really see if you need to get them out. And the other recommendation is wait to get them out. So if you get them out earlier, 16, 17, 18, there's a higher incidence of having forming cavitations because the tooth is not fully formed yet. The tooth bud remains in place, and that could be one of the contributor factors. If only part of the tooth is removed and the tooth bud is there, that can lead to not abnormal bone formations. What are the problems with zirconia implants? Minimal if you know how to use them properly. In the past, ceramic implants have been associated with fractures. That has been kind of resolved with newer technologies. But I think the biggest problem is not have enough education to use them properly. So a titanium implant is not the same as a zirconia implant. So if a surgeon that places a lot of titanium implants will try to use zirconia implant in the same way, they will not have the results that they expect with with titanium. So definitely go with somebody who who does a lot of zirconia implants because the two are not the same. Another question is, what are your thoughts about permanent metal retainers? It's still a metal alloy, and oftentimes it will affect, energetically for patients. And the permanent retainers that are metal, you don't know what the alloy is, and it's inside the mouth, so you're going to have degradation of the metal and release of the metal ions. So I think there's better alternative options than having a permanent metal retainer. So my philosophy is no metal in the mouth if possible.
Yes, you have a question.
No,
There might be one or two coming in from me.
okay.
It's not.
Yeah, yeah. Carrier pigeon.
The day-to-day treatment for oral health. So it really depends. I think the biggest thing is your diet. So what you put in your mouth is just as important as what you do with the oral cavity. It depends, what kind of dental treatments have you had in the past. So that's an important factor. The more dentistry you have, the more problems you will have. So nothing beats natural teeth. Also frequency of eating. So, intermittent fasting, just like you need to, fast for the rest of the body, letting your mouth not have food there all the time and deal with different acidities is important. But in general, brushing twice a day, oil pulling is good. If you don't have any other conditions, that's really all you need to do. And, making sure you watch your oral microbiome. Again, your oral microbiome is going to be affected by what you put in. Biocidin toothpaste question. It is a good toothpaste if you have periodontal disease, if you have active periodontal infections, but however, it does kill things naturally. So, just like in the gut, we don't want to constantly nuke our gut microbiome. Oral microbiome needs to be taken care of. Oral probiotics are important. That was my initial introduction to Zymogen and Nina when they had the Zymogen DDS oral probiotic. So if you don't have any dental problems, you shouldn't use biocidin because you don't want to kill healthy bacteria. If you have periodontal disease, if you have issues, that is a great tool that is for treatment, but it's not a forever toothpaste in my preference. Any problems with cadaver bone implants? So I think the question is, is there problems if you use cadaver bone when using bone grafting? The short answer is there's potential associated with it. Oftentimes that bone will not resorb. So when we do bone grafting, the goal is to create healthy, vital bone full of blood flow. So, the only way to create it is the graft material needs to fully resorb and your body's got to make your own bone. Otherwise, it's an inflammatory reaction that your body is kind of walling off the graft material. So cadaver bone, if you're using cortical bone, that is not resorbable, that is just incorporated within the bone without having full blood flow, which could create, inflammatory processes.
Where did you get the bone from?
Oftentimes your bone, that's from other parts of the jaw if possible. And then PRF, to be honest, most of the grafting we are able to accomplish using PRF, which is platelet-rich fibrin. So we take your blood, process the blood growth factor, stem cells from that, and then that stimulates your body to make new bone. So 90%. PRF is kind of like more advanced than PRP. PRP is just liquid form. PRF has fibrin in it and doesn't have anticoagulants, so a little higher growth factors, but in the same family, but more potent. Recommended toothpaste, Risewell, Boca, those are good. Tooth and Gums Tonic, toothpaste, some different toothpaste. There you go. Hydroxyapatite is Risewell has hydroxyapatite, helps with remineralization, preventing tooth decay, and no fluoride, and obviously no toxic chemicals as much as possible. So Risewell is the brand. Boca is another one. Tooth and Gum Paste is another one that doesn't have hydroxyapatite, but another good clean toothpaste.
So what about brushing with activated charcoal?
Activated charcoal is good for removing stain, but could be too abrasive for everyday use. So the concern is overbrushing and loss of enamel. So I wouldn't recommend activated charcoal every day. That's something that could be used once in a while if you have a lot of staining on the teeth. Yes, safe, yes, but potential overbrushing is always a concern. Same thing as charcoal, not for everyday use. Too abrasive for every day. Yeah, every once in a while you can use it. Yeah, absolutely.
Better options than metal retainers.
Non-metal retainers.
What?
I mean, the best retainer is, your natural stability of, your muscular function to keep the teeth in place. But you can use Invisalign style retainer, like a clear plastic retainers, which, again, have issues associated with plastic.
So no braces, Invisalign.
No braces.
No metal braces, use Invisalign.
I mean, depends on what age group, and depends what you're trying to accomplish.
Well, I'm having 11-year-old use braces.
It's a double-edged sword. Compliance, 11-year-old and Invisalign could be compliance issues.
Okay, well, do you have a replacement recommendation for the Clifford reactivity test?
They're backup.
Well, there's another laboratory now doing it again. Doing the same test.
The Clifford reactivity test?
Yeah.
Okay.
Which white fillings do not have plastic PBMs? So the material that we use is actually ceramic filling material. It's by Voco. It's Admira Fusion. And then if you go on our website, Natural Dentistry Center, you can read about the BPA-free dental materials. And then cavitations, ceramic implants. Best floss, Coca floss is a good one. Yes. Risewell has a floss with hydroxyapatite. That's an option as well. Good.
Okay, time to wrap. I'll close up.
Good.
Okay, well, I think we're just going to close up here real quick and then we can continue here in Connecticut. So thanks to everybody for joining us this evening in Massachusetts, Rhode Island, and Maine. We are actually looking toward a spring meeting tentatively scheduled for March 21st. And we are actually actively looking for a site to hold the meeting at in New Hampshire. Our speaker tentatively slated is Dr. Julia Greenspan, who's a naturopath in Amherst, New Hampshire. And she is going to be, her practice is greenhouse naturopathic medicine. She's going to be speaking on Lyme disease, which is one of her main areas of focus, as well as ozone therapy. And also she's seeing what she's doing with ozone therapy and hypercoagulability in her practice. So that's slated for March 21st. We also, through the Greater Boston Functional Medicine Group, are planning to hold experiential sessions for practitioners to come together to share expertise and experience firsthand with emerging therapies such as cold laser therapy. And so with that, we'll close. And again, thank you all for your participation this evening. Please do visit the Greater Boston Functional Medicine group site, and we'll send out the link for you so that you can register as a member. And we will also be sending out the recording following this meeting very shortly. So thank you all again, and we hope you have a great evening. And let's see.